So we know that one of the things about thyroid surgery is there's a nerve that goes underneath your thyroid gland. It travels down through the neck, around a blood vessel in your chest, and comes back up to the voice box, okay? Called the recurrent laryngeal nerve. But there's one on each side, and one of the risks of surgery is that nerve lies right underneath the thyroid gland, okay? And so it's at risk whenever you do an operation. Now, is it at risk when you do a nodule ablation? And the answer is yes. But one of the things that's really important, and like when I heard the guys from Johns Hopkins talking about this, they go through great painstaking task of saying that not everybody is a candidate for RFA. Right? If that nodule is in a certain location that is really right next to that nerve, it puts that nerve at risk. Recently, we've had some reports of vocal cord nerve injuries.
Okay.
That should not be with RFA. It should not be. And let me tell you why. You should pick nodules that are appropriate for the technique, that are going to be safe. Okay? If you're going to have vocal cord nerve injuries, it takes away one of the big advantages of RFA, which is that you don't have that risk. But if you introduce that risk, then all of a sudden, is it surgery safer or RFA safer? There has been a big swing towards people doing sedation with RFA.
Really?
Yes.
Like full sedation where they're completely asleep?
Sedation where they are sufficiently asleep that they don't have to, quote, endure.
Oh, goodness.
Okay. So, and
that's a problem when you're trying to monitor their voice, correct?
Well, and that's the thing, yes, is that there will be a change in the voice or pressure or pain or heat before there's any permanent nerve damage. But if the patient's asleep, you take away that safety net.
Yes.
And so I've had a couple of people who have talked to me about RFA and called back and canceled their procedure because someone else was willing to sedate them to do it.
Oh, dear.
And it cost them an extra $400 or $500 to get the sedation.
Yeah.
But there's risk involved with that sedation, and you take away part of the safety we have with those nodules.